Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Hello.
Hi.
Hi. 9:15 coming in hot from Kansas. All right. We actually have an episode with some good topics tonight. Last episode was kind of just a catch-all. So we do have some good stuff. We're going to talk a little bit about menopause and just how pelvic floor therapy can help with the vaginal changes. But first, Rex and I started a little pre-conversation and we started laughing. And I said, we have to stop this and start recording and we'll go over our tell us something good. So, okay, this isn't really something good because I just recently got over the stomach flu. And so that's not good. But I was telling Roxy that I was laughing at myself through the midst of the sheer terribleness of the stomach flu that only a pelvic floor therapist, I think, thinks about this while they're puking. I just kept thinking, oh, my pelvic floor is doing so good every time I puke. And so I would throw up and then I would lay down on the bathroom floor, just thinking about when the next time was I was going to puke. But it literally crossed my mind like 3 or 4 times. I'm like, I really need to pay attention to how my pelvic floor contracts while I'm puking the next time. And so Roxy informed me that what do you do while you throw up?
I don't even give my pelvic floor a chance. Like, I just sit on the toilet while I'm throwing up into the green bucket. It's iconic in our house.
The green bucket.
The green bowl. It's a big old Tupperware green bowl.
Now, I would do that if I also, this is a great conversation, guys. If I thought I was also going to, have diarrhea. That's happened before, where you're like on the toilet, you don't know if you're going to throw up. But anyway, so I was telling her that I just sit on the ground like crisscross applesauce right in front of the toilet. So it just brought up a funny conversation of like, how do people throw up?
What's everyone's normal?
Yeah, what's everyone's normal? And yes, your pelvic floor takes a beating when you are vomiting. So give your pelvic floor a round of applause and tell it thank you for the work that it does during that time. So anyway, my tell me something good is I made it through the 24-hour flu bug. So I'm happy about that. And although I'm a little sore, I made it. And I just kept telling myself it's 24 hours. It's 24 hours. So here we are.
That's good.
Yep. All right. What about you, Rox?
I just had a really good, mellow, chill weekend that I really needed. It was raining and I love the rain. Yeah. And I love the rain when I can be home and just be cozy in my house and turn some candles on or whatever. And so anyway, It wasn't anything like exciting, but I just felt so good by the end of the weekend. I thought this was
best.
Just the perfect fall rainy weekend. So
good.
Nothing specific, like nothing cool. It was just a vibe and it was a good one. So
we started pulling out our Christmas stuff this weekend. So that all happened before the stomach bug because I wanted to take my time and do some new stuff on my mantle. And I didn't want to be rushed. And we have stuff coming up at the end of the month. So we just started slow. I still don't have it done by any means. So that was kind of nice. Yes, the rainy cold and just me and my creative mind doing things at my home that had nothing to do with work. And that was really great.
I'm an after Thanksgiving girl. I can't do it. That's the rule in our house.
Oh man, that's how we were growing up. And I used to be like that, but we love it so much. And now I feel like Thanksgiving and Christmas are so darn close together that we just don't get it up long enough. So we got some twinkle lights going on in the family room right now. I had to laugh right before I came in here. My son, Owen, he's 10. We got a new down comforter on our bed and he came in and he loves soft, cuddly things. And I was like, all right, I'm going to come in. I was like, I got to go in because I got to go in. And I think I said something like record. And he was like, Oh, yeah, it's podcast recording. And I don't know, the way he just said it made me laugh. So like chuckle because it's like, oh, yeah, like no big deal. Like that's just what mom goes and does. It's just so funny. He cracks me up. He also has figured out I have one of those PEMF mats and it's like, so it's a grounding mat. And then also it's like the infrared, it gets warm. And I've had it in my room and I just haven't have it set up. And so I've been using it here recently. So when I take it off, I don't fold it up. I just lean it against the wall. And last week I came home from work on Thursday and he had taken it upon himself to put it, he like figured out that you just put it on the bed and you like plug in this cord to it and he like turned it on. I come in and he's just laid out on this mat watching TV. I said, did you set that up yourself? He was like, yeah, it gets so warm. It feels so good. So he's like all weekend. That's all he did was he just laid on that mat. I was like, good. Ground yourself, buddy. I
Oh.
love it. Kids. All right. Well, let's get to it. So menopause has definitely been a hot topic, it feels like lately, and it should because it's finally getting more research and more attention given to it. And so we just wanted to talk a little bit about like what our role is as pelvic floor therapists and a really good study that was done not too long ago that shows really good results. But, often we talk about pelvic floor therapy in combination with the use of estrogen. And we know that 42% estrogen can help up to 42% of women like with symptoms. And we know that pelvic floor therapy with stress urinary incontinence can help 50 to 70%. And so the thought is why not combine the two? Because you'll get really great results. And you do. However, some women just they're not ready or they don't want to try the topical estrogen. And that's what I'm talking about is vaginal estrogen here. So that's what we're going to talk about is our different options that we can look at when addressing symptoms of decreased estrogen or menopausal symptoms.
We're going to focus on, we want to recognize that menopause brings a whole host of symptoms for the whole body. And so, like traditional, like hot flashes and mental health changes and just like tons of things. Because we're pelvic health rehab specialists, we're going to focus on the pelvic health considerations that come along with menopause. And so one big area that we're looking at is what's called genitourinary syndrome of menopause. And that's where the tissues around the vulva and the vagina are changed because of the change of hormones there. And basically what happens is the tissues, they become less hydrated because they're not as like plump, I guess we could call it. They get drier, and they lose their integrity. And so then that can lead to a lot of things, as far as urinary dysfunction, painful intercourse, vaginal dryness. And then that's where we as pelvic rehab providers then can step in and help intervene with some things.
Yeah. So like Roxy said, GSM, so the genitourinary syndrome of menopause affects up to 84% of women. That's a pretty big number. And, I think that we think about menopause as, oh no, like, what's this going to be like? And really all the stuff we're finding is that we really can process through perimenopause, menopause in a really honestly graceful way and be able to now have more information of how to help support our bodies. Yeah, the GSM, like Roxy just said, it can cause vaginal dryness, can cause itchiness, painful intercourse, increase in daytime urinary frequency, urinary urgency, urinary incontinence, increased risk for UTIs, like we said, pain with intercourse. And all of those can be also getting diagnosed with like repeated UTIs. And lo and behold, it's not really a UTI, but yet we have these symptoms of this like UTI type of combination. And come to find out, it's more of a decreased estrogen state of the tissue. The urethra is irritated and, there's lots that can be done to solve this and not be given more and more antibiotics. So yeah, there's also a misdiagnosis too of yeast infections due to all these issues. And the bladder actually, with the decrease in estrogen, the bladder can actually kind of shrink just a little bit and have a thinner lining. That again, we think about that bladder irritation. And this is all stuff that it makes sense now that as we know more and more, but we just don't consider, that's not our first go-to, is being like, okay, we need to consider like, where is this woman at in the, process of menopause, or how, are these first signs perimenopause, those sorts of things. So anyway, it's just fascinating and just awesome to be able to have this solid research now that we're starting to see. So we have this GSM, and like we just mentioned, often vaginal estrogen or some sort of, there's different options, which that could be a whole nother podcast of estradiol cream and estriol and DHEA and all that stuff. But for all intents purposes, we're just using the general vaginal estrogen. And so that can be a really great, helpful tool. It helps plump tissue. It helps soften the tissue, helps re-estrogenize it. And so this can be really helpful. But like we mentioned, sometimes women don't want to. So want to use this. So what do we do if someone doesn't want to? And there was a study done in 2020 that was looking at, it was really awesome. So the study looked at combining pelvic floor therapy with vaginal moisturizers. So Roxy, tell us a little bit about vaginal moisturizers and kind of, which ones you use in the clinic and what's the lowdown?
Gotcha. So the idea with vaginal moisturizers is just thinking about, I think a really good analogy is, as your skin, your face routine changes as you go through different seasons of life. So does your vulvar skin routine. And so thinking about Megan had said 40-ish% of women respond well to estrogen. Well, then where does that leave the rest of the women? And so what we're finding is that there's a really big research base that's pushing for hyaluronic acid. And that's one that is one of probably my biggest go-to of, it's over the counter and, it's easy, and it's basically just some vaginal moisturizer, but the evidence is really strong behind it for women, either that want something alongside vaginal estrogen cream, or for women who would rather not use topical estrogen, or maybe that topical estrogen isn't effective for them. And so this can be a really, really good adjunct. There's other vaginal moisturizers that I think you could probably line 50 women up, and they're all going to maybe tell you something different or what they love, what their favorite is. But just as far as the evidence goes, right now, the hyaluronic acid's the superior option for just the topic of vaginal moisturizers. But that can be really helpful just to, it's like, essentially how we put lotion on, it's not like, it's not a necessity, but it sure can help, right? Like, we can function without it. We can survive without it. But just like the quality of life or the quality that it brings to the tissue, just even anywhere on our body, but we're just talking about a really sensitive area that has high symptoms and high dysfunction during these menopausal transitions. And so it's like just a really good, it's not going to hurt anything usually, like not very often, or I haven't ever had anyone that responded poorly to it or like adversely to it. And so it's one of those things where it's like, why not?
Yeah. And I'll often, well, first off, if I have somebody coming in and they're having a grouping of symptoms, I will often start with a hyaluronic acid vaginal moisturizer. And then it might be that maybe we have to move to finding out, and asking their provider to see if we could trial some vaginal estrogen cream. And so then if that's the case and they start the estrogen cream, I'll do the vaginal moisturizer on the nights that they don't do the estrogen cream and alternate them. But also, you think postpartum and those early postpartum months when you're nursing and or not, but your estrogen is plummeted. And often we have symptoms of like, we're feeling like there's a yeast infection, vaginal irritation, vaginal dryness. Man, at those times, these vaginal moisturizers are so helpful, especially if you're not wanting to add in, like let's say you are nursing and you are a little bit hesitant, like you already have a low milk supply and you really don't want to risk putting any sort of topical vaginal estrogen vaginally, even though most of the time it's a small amount. So most women are okay. But let's say you don't want to. The vaginal moisturizers are super helpful. So there's different brands. And if you're seeing a pelvic floor therapist, they can kind of guide you in the right direction. We at our clinic have different samples of different brands. And so we just see what somebody likes. And yeah. So anyway, but this study looked at, it was 12 weeks of pelvic floor rehab combined with the vaginal moisturizer. And when we say 12 weeks, that doesn't necessarily mean that somebody was being seen every week for 12 weeks. It was over 12-week period of doing a very good but a very good structured pelvic floor program.
What that means is like the patient came in, got a good program, maybe came back like a week or two later, confirmed everything was good. So the patient is doing consistently 12 weeks of a guided program from the pelvic therapist, but there's kind of touch-ins with the therapist.
Yes. So we're also not talking like patient comes in and sees for eval, comes back in a week later, is doing good, and then doesn't do any of the at-home work, and then just comes back in 3 weeks later and then doesn't do anything. Like this is, you're doing your stuff at home. Yeah. This involved, active, participating client. So they did the study. And so they found that the pelvic floor muscle training, which we know this. And so applying it to these menopausal patients is really awesome. So it significantly improves blood flow from multiple arteries in the pelvic floor. So with that, we have improved blood flow. They saw significantly increased the speed of pelvic floor muscle relaxation. So that's super important after a pelvic floor contraction to be able to relax the pelvic floor. And if you're able to relax that pelvic floor, we're able to get that tension off of those muscles. We're able to increase blood flow. There was significant decrease in pelvic floor muscle tone, which we would expect if we're able to have a better, quicker pelvic floor relaxation. We're going to expect for that tone, that muscle like tension to improve, as well as increased pelvic floor muscle strength. So we would also expect to see an improvement in strength because now we're able to move through a better range of motion through the pelvic floor. So we see how that all kind of plays in. So the tone decreases. So we're able to have more range of motion. So we're able to have better strength. That more range of motion means we were able to relax better. And all of that combined increases the blood flow to the area of the pelvic floor. And also with that, they saw improvements in skin elasticity and introitus, which is the vaginal opening width, when observed and measured by the vaginal atrophy index. So if you can imagine, if you're somebody that's having painful intercourse and you're in this state of GSM, you've had tissue that is dry and tightened and almost like kind of like a shortening or, tightening of the opening to the vagina, that's going to be painful. And by looking at the study and being able to see these outcomes, and this is just with doing a vaginal moisturizer and pelvic floor therapy. So you also could apply this to anybody outside of the menopausal state too, which is, I'm like, this study is amazing because
well, that's what's so funny is it's like
we know this.
This is our bread and butter. Like this is what we're preaching and we're attempting to achieve with absolutely every patient that comes into our office. And so just for there to be a study that says, look at what this does is like, I don't know. I feel like it's a breath of fresh air to be like, see, like we're not just blowing smoke. Like this is literally,
this is legitimate.
This works. And here's the data now to finally like prove it. It's obviously in a really specific subset of people, but goodness, also consider. So like, I'm going to just throw a little nugget in here is as females, we start losing muscle mass at 31 years old.
Yes.
So if it works with women in their like 40s, 50s, 60s, then it's going to be working at this is going to be actually even more effective like the younger people are. And so I just think it's an exciting kind of study to think about of, even though it was studied in like the menopausal population of women, we never lose our capacity to become stronger. So there's not a ceiling on what age of female this would be effective on. But then also if we are more disadvantaged in the menopausal area, not to poo-poo on the menopausal, like it's just a fact, like we don't have the capability of being as strong. So the study shows that like there was good outcomes in these women. And so it's like, well, it's going to work on anybody younger then too. It's going to be even more effective on people younger. So I think if we really step back and say, what's this showing us? It's just like improving the effectiveness of investing in yourself just a little bit. 12 weeks. Like, is it worth it for 12 weeks?
Yeah. The thing about it is I think, and again, we can get on our soapbox of why I don't love the devices and the chairs and the V-tones and all those sorts of things. But, really, pelvic floor muscle rehab is a low cost, conservative treatment with no side effects other than like, you're going to learn your body better. And, like, if anything, you
only
become
good side effects.
Only good side effects. Exactly. So honestly, I think it's a really great option, especially with what we have out there now. And by the way, this topic was talked in depth when we were at the Pelvicon conference, and the amazing Michelle Lyons just educated so well on this, which is, where we're learning all this from. And she does such a great job of sharing the research with us. So when we talk about the blood flow, we see with that there's noted increased vaginal secretions, increased pinkness of the tissue, increased thickness of the mucosa, increased elasticity, and then that wider introitus, which is what we talked about before. And gosh, I mean, again, what I love about this is we know we're looking at this particular age group in the study, but this can be applied. We see lots of younger women that they come to us post getting off of birth control pills or different things like that, and they might have had some major shift in their hormones, and we're seeing almost symptoms of a de-estronized tissue. With that, again, we can start with the vaginal moisturizer, and this is what we're doing, a pelvic rehab program with them, and they are improving. So I think that just knowing what we're capable of as pelvic floor therapists, and I think that's been a biggest thing here lately for me, is just realizing, like, if we're not talking about this more and we're not sharing it more within our local community and people don't know what we can do or what we do, then, like, if they don't know we're here, they don't know we can help. So I think it's just, there's still not an association with like, okay, I'm in menopause. Part of my menopausal plan is I'm going to see my doctor and talk about hormones, and I should go see a pelvic floor therapist so that I can combine the two to have the best outcomes. Like, that should be, in my opinion, where the education should go. Just like, I just had a baby, or I just found out I was pregnant, I need to go schedule an appointment with my OBGYN, and I need to schedule an appointment with a pelvic floor therapist. Like, this is just part of my team that you're developing, and we are there to help transition through different periods of time. So, I mean, we've talked about this. Roxy and I both have done the fertility cert. So preconception, through conception, all the way until postpartum, and then on. So, but that being said, not every pelvic floor therapist has specialized skills within those areas. So it's just also too making sure that you're searching for the right therapist that has training in these areas. Yeah, I don't know. I was just really excited to kind of like dive in and learn more about all this and these awesome studies that have come out, because it is, like you just said, Roxy, it's like, this is our bread and butter. It's cool.
I like it.
Okay, so hopefully now, if you were wondering if pelvic floor therapy could help you, honestly, at any stage, but primarily at menopause, and what pelvic floor therapy could do for you, or like what was the purpose of it, hopefully this helps you understand what our role is and how it can influence your outcomes and how it can improve your symptoms through the pelvic floor. Obviously, there's a lot that goes into what that 12 weeks looks like. And that's why, if you have questions about that or want to work with either one of us, you can message us directly, or, find somebody in your local area if you're not local. And two, just knowing that if you thought that estrogen was your only option in order to improve those symptoms, hopefully now you understand there is an alternative. We like choices, and it's because it's not for everybody. And even though we know that it is amazing stuff, we also recognize that it is not for everybody. And maybe you're just like in the beginning stages of perimenopausal and you're not quite wanting to do that yet, but you're having some of these symptoms. And now you know that evidence is there, strong evidence, which is just, super exciting. Our field is just growing so much, and that the research is getting better and better. So,
yeah, that's just what I was going to say. Yeah.
Yeah.
I was just going to say it's an exciting time right now. We have access to so much new information. Well, just if you're going through this season and you've heard the women who have pioneered this before us, just like be miserable or it's been a negative season. I think what's interesting, one thing that stuck out that Michelle said was women in their 70s have the highest life satisfaction. And I just think that's really exciting to look forward to, of like, man, this might be just a challenge of a transition for a lot of us, but we're learning how beneficial different services or treatment options are that haven't always been known. And so then just to even look forward to those years ahead of us where we can just like be really, have really rich life and, there's good ahead and it's not just negative. And so anyway, I would just stay tuned. I guess I just encourage women too, to kind of stay tuned and be on the lookout for, this is what we know and it's really exciting, but this was probably just the tip of the iceberg. We're going to just keep learning more and more.
Yeah.
The female population is becoming more and more researched. We were just not researched well up until recently. I think we're on the front end of some really exciting knowledge that'll start to become more common knowledge. And so I just would encourage women to kind of be on the lookout for the newest and latest research that's going to be coming out in the coming years. I think it's just exciting to imagine how, quality of life will be improved and we'll just know more and we'll be able to transition smoother through these different seasons of life.
Yeah. And we just encourage you to ask questions and get curious and speak up about symptoms that you're having with your body, and know that if you don't speak up and ask or tell your providers what's going on, they won't know. And so they don't know how to help you, or they don't know how to refer you to the right people. So just remember that they are there to help. In the area that I am in, we really do have some really great OBGYNs and functional providers. And my hope is just that, we can continue to build teams around our clients and patients to just support everybody, aging gracefully, because it feels better to be well. So, all right. Well, let us know if you have any questions, like and comment and share, if you will. Do us a solid. Until our next episode, we will keep the conversation going, and we'll talk to you in 2 weeks. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.